So India is my life. They've really brought back my life. The second chance, I've got it from India. I was diagnosed with a colon cancer. Roughly it was like 1 kilogram in my large intestine. So they tested it. It turned to be cancerous. So we saw the cancer specialist from Lago Hospital, that is the referral hospital in Uganda. So he said we should do a PET scan. PET scans, we don't have it in Uganda. The only PET scan we have is in East Africa is in Nairobi, Kenya. My elder brother, who is called Joseph Movawala, decided that we should come over to India in a one-stop center. We do the PET scan plus the treatment for my colon cancer. We came at night, time difference. So we came to HCG Hospital. We met Dr. Viraj. So Dr. Viraj started on with the counseling, and they said, he asked me, I'm gonna do a PET scan for you. So we did that PET scan that very day. The results came out and they were very terrible. I had tumors on my liver, they crossed to my liver, and one tumor, the smaller one, stayed in the colony. So there were around 8 tumors on my liver. So he said, now, the only thing we are going to do, we can't transplant your liver, we are going to use chemotherapy. Are you ready for it? I said, I'm ready right now. I was so positive about it. So that night, we started the chemotherapy. The nurses and all the staff were very good to us. They kept on checking on me. Though I was very weak, but I managed to go through the first round. So I did 8 chemotherapies. So towards the last 2, I had a serious reaction with I got ulcers all through my throat. So, and back home, my mom was not really fine. They were so worried about me. They thought, actually when I came in, they didn't know that I would go back alive. So Dr. Viraj decided that we are going to allow you to go back to Uganda. You should get an oncologist back home who is going to deal with you. We did all the PET scans. The tumors they were shrinking, both of them, more than half, before I left for Uganda. So they packed all my medication, we purchased. So it did another 7 rounds to 6 rounds of chemotherapy. Dr. Viraj told him that they should put a chemopot. So this chemopot that I have right now was placed beneath my skin, so I have a chemopot. So I finished that treatment of the 9 rounds. So I was asked to come back in India in January to do the PET scan and all the tests, of which tests I did yesterday and the other day. So the results came out. They were really very positive. The tumors are no longer seen in my liver, according to the PET scan. And the tumor that was in my colon also has disappeared. And we did all the tests that the doctor decided that I should perform. So the results came out good. So the doctor has decided I should get off chemotherapy. The coloring of now they are clearing, they were black because of the medication, and my feet. Then my hair didn't break off. So the type of chemotherapy I'm using was really good. Right now I'm fine, I've put on weight, I'm looking better than how I was. So I'm very happy. And back home, we told them about the results. Everyone is very happy that I'm going to be off this medication for 3 months. And now I'm feeling normal. No problems, no pain, no nothing. So all in all, thank you so much, HCG, all the doctors and all the nurses. I'm really very, very overwhelmed, and I'm very happy for the treatment I've got, and I promise I'll really explain this to all my fellow cancer patients in Uganda who can afford. Whoever can afford to come over for treatment, they will come over because it is really good treatment. So India is my life. They've really brought back my life. The second chance, I've got it from India.
When my brother was really bad, we thank God that now he's alive, he's speaking, and because of the treatment he has got from Uganda and in India, he is really happy and alive again. We would like to thank the following people. We would like, first of all, let me thank the management, the technical and staff at HCG Hospital, Ahmedabad in India, for the work they have done to my brother Stephen Kakete.